Concussion is a traumatic injury to the brain. You do not have to lose consciousness or even sustain a head injury to get a concussion. It's the most important part of the entire talk. Brain rest.
What happens if you don't practice brain rest? Is there a treatment for post-concussive syndrome? How can you prevent a concussion?
Welcome back. Today we tackle concussions. A concussion is a traumatic injury to the brain. This can cause damage to the brain cells, which can then result in abnormal brain function.
How do you get a concussion?
Concussions most commonly occur from trauma, such as head injuries. The CDC estimates 3.8 million concussions occur in the United States every year, usually from sports and recreational activities. But you can also get a concussion from whiplash, for instance in a car accident. You do not have to lose consciousness or even sustain a head injury to get a concussion.
What are the symptoms of a concussion?
Symptoms can vary, but often include headache, repetitive questioning, confusion, change in vision, nausea or vomiting, difficulty concentrating, sensitivity to light, difficulty sleeping, lightheadedness, and even memory loss. Sometimes concussions can mimic something more serious, such as a brain bleed or stroke. It is very important that you see your doctor if you have any concerning symptoms.
How is a concussion diagnosed?
Well, concussion is a clinical diagnosis, meaning it is usually diagnosed based on history and physical exam. However, your doctor may get a CT scan of the head or an MRI of the brain to check for something more serious. That is a discussion between you and your doctor.
How are concussions treated?
This is the most important part of the entire talk. Brain rest. It is critical to allow time for your brain to heal after concussion, especially the first 72 hours after concussion. It is sometimes hard to describe brain rest, so I'm going to break it down with a few examples. Number 1, limit the amount of time you are on your phone, watching TV, playing video games, reading, or using a computer.
Sounds like limiting the amount of screen time is key.
Yes, you also need to avoid demanding mental activities. For example, avoid multitasking and focus on one task at a time. Limit activities that require a lot of memory or studying, and hold off on puzzles and crosswords.
That's pretty tough to do without taking off of school or work.
Important point, you may need a few days off school or work to allow your brain to recover and heal. Remember to avoid strenuous activities. And lastly, but very important, avoid further head injuries.
When can people with concussions return to sports or other activities?
There is no set timeline as to when somebody can safely return back to work after concussion. Each person is different, but the CDC does recommend gradual return back to physical activity based on your healthcare provider's recommendation and your symptoms. This usually takes at least 1 to 2 weeks. It is not worth it to rush the healing process.
What happens if you don't practice brain rest?
Brain rest is very important to allow your brain the best chance to heal. We worry about something called post-concussive syndrome. That is when the concussion symptoms do not fully go away, and they can last months to years.
What does post-concussive syndrome look like?
Well, everyone is different, but often people have long-term difficulty sleeping, difficulty concentrating, headaches, depression, ringing of the ears, and memory loss.
Sounds rough. Is there a treatment for post-concussive syndrome?
That's a good question. Yes and no. We can treat the symptoms of post-concussive syndrome, such as nausea or headaches, but there is no easy cure. Prevention is key. Neurologists and sports medicine physicians are doctors that specialize in concussion care and can help if you have post-concussive syndrome.
How can you prevent a concussion?
By preventing an injury to the head or protecting the brain. Always wear appropriate protective gear and helmets when able, with any activity that can result in a head injury. This especially includes sporting activities, such as riding a bike or motorized vehicle, skateboarding, snowboarding, skiing, horseback riding, and contact sports. Remember to supervise your children playing. Lastly, many falls in older adults can be prevented by eliminating stairs and taking other measures to fall-proof your home. Talk to your doctor about making your home safe from falls, reviewing your home medication side effects that can contribute to falls, and checking your vision.
Motorized vehicles. Does this include electric scooters and bikes?
Definitely. I've seen very serious injuries from these. Remember to protect your head on any motorized vehicle. I often see worst case scenarios in the R position, but you have one brain for life.
Let's recap. Concussion is a type of brain injury that can result in headaches, nausea and vomiting, difficulty concentrating, and memory loss, among other symptoms. The treatment for concussion is brain rest, including minimizing screen time and minimizing intense concentration. Prevention of injury by using protective equipment and being cautious during high-risk activities is very important.
And that concludes our talk on concussion. Remember, none of this information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you are concerned about an emergency or serious medical condition, please call 911. And keep tuning in for more information about common medical conditions. And don't forget to like and subscribe if you find our content helpful.